Are you seeking pain relief, but you have some concerns? In this video, I'm going to address some of the most common questions people have about chiropractic care and physical medicine. Hi, my name is Dr. Chris Goebbels, and I'm the founder of SquareOneHealth. And a lot of people are curious about chiropractic care and physical medicine, but they don't know what to expect. They're afraid that maybe it'll hurt or maybe it won't work. And in this video, I'm going to answer some of the most common questions people have about both chiropractic care and physical medicine, so you can make an informed decision if it's right for you. Does the treatment hurt? Well, first of all, there's lots of different treatments that may be right for you, whether it's chiropractic care or physical therapy, maybe it's trigger point injections. And although these treatments aren't really painful, there can be some initial soreness in the beginning, similar to, if you go to the gym and you haven't worked out in a while. So there may be some discomfort initially, but we have ways to accommodate patients from infants to senior citizens to really provide the most comfortable care possible. So you really don't have to worry about the treatment being painful. Another concern that you may have is will the treatment actually work? Well, the first thing to ensure your success is to find out exactly what's causing your problem. And once we know what's causing it, then we can customize the perfect treatment for you. And when the treatment's customized to your individual health problems and your health goals, the odds of success are much, much higher. Compared to most clinics you go into, you're gonna see people get very similar or almost all the same treatments. Every single thing we do is exactly customized to help get each patient the perfect treatment for their individual health concerns and to help them reach their individual health goals, which dramatically increases our success rate. So, a great example is someone could come in for back pain, and maybe they're a good candidate for chiropractic, or maybe they have a disc bulge or a disc herniation and decompression therapy is better for them. Maybe someone has lost the curves in their spine, they need very specific treatment to improve the curves, or maybe they have some core stability problems and physical therapy is the right things. And that gives you some examples how you could have one complaint, but there could be many different treatments or different options to make sure that person's getting the perfect treatment for their individual needs. Another question that comes up is, what are the treatments actually going to cost? And honestly, we don't know until we actually have a chance to evaluate you. If we can't help you, it doesn't cost anything. And the treatments can vary quite a bit. The way to look at it is, what is the cost of not fixing a health concern? So this is truly an investment in your body, it's an investment in your health, and really it's an investment in your future. So we get asked a lot of times, what are the things we treat? Well, first of all, most of the things that we're treating are musculoskeletal problems. Anywhere from back pain to neck pain to headaches, shoulder issues, hip problems, knee problems. And then we have some things that we really specialize in, such as scoliosis, neuropathy, and we treat a lot of patients that are involved in motor vehicle collisions. So really what we do initially when someone comes in is we do want to provide them pain relief, because most people come in because something is physically bothering them. But beyond that, we actually want to fix the cause of the problem and then get people at a really high level of functionality so they can live their life best possible. Yeah, a lot of people know that they have a symptom. A symptom is just, basically it's a complaint. It's a warning light that something is not right. And that's part of doing a really detailed consultation, going over your history, and a very thorough exam to find out exactly what is causing your problem. So it really makes us different about scoliosis, as we're the only clinic north of Denver that's actually trained in treating scoliosis outside of doing surgical treatments. We do customized scoliosis bracing, and we are a certified clinic to do ScoliBrace specific bracing. And we do scoliosis specific exercise, which is very specific type of rehab that takes some advanced training to be able to deliver. A lot of our scoliosis patients come locally, but we do have patients that come nationally from many different states, and we help a lot of other doctors manage their scoliosis patients. A great example of that is we have chiropractors that will send us their patients that need treatment for scoliosis, whether that's a brace or scoliosis specific rehab, and we manage the scoliosis part, but we send back to the chiropractor to do their chiropractic treatments. So people come locally, but we do have people that come literally throughout the whole nation. So as far as how long treatments last, that really depends on the individual patient, but with every patient's treatment, there's definitely a specific begin date and an end date, and there's very objective things that we're measuring to know when we have reached the overall goal. That time frame on average is probably anywhere from 1 month to 3 months, But some cases where there's more traumatic injuries, or maybe they have something like scoliosis and they're growing and developing child, those can take longer. But once we've actually corrected the problem to the best of our ability, I would say a large number of patients come in for more of a maintenance or wellness basis, where they're really just getting tuned up and trying to function at a high level of life, which is different than actually fixing the problem that they first came in for. People ask a lot of times who are candidates, and we can treat infants all the way to senior citizens, but most of our patients we start at is in childhood, probably around 8-9 years old. Once a child can actually stand up and walk on their own, those are the kids that we see most often, all the way up into senior citizens. If you do have questions, the easiest thing to do is give our office a call. Someone on our team will be able to answer your question, and if they can't, we'll make sure one of the doctors gives you a call back personally to answer any of your specific concerns or needs.